Mr. President.
Senator from Alaska.
Mr. President, thank you very much for the opportunity to be here this evening. Senator Cardin, thank you for a great presentation on the real facts behind this bill. You know, being from Alaska, we see a lot of winter storms. We saw a great blizzard here that just occurred and dropped a lot of snow. I see a lot of blizzards and storms in Alaska, but I have to be honest with you, I've never seen a blizzard like I've seen here in Washington of the misinformation about this bill. Hopefully, in the next few minutes, I want to talk about the general bill and what it means for all Americans, including Alaskans, and then specifically about the effect and what it does for Alaska. First, I want to walk through a couple things and some large issues. And I know people who are watching hear this over and over again, what we're on this bill and the details of it, but I think it's important that we repeat it enough for people to be reminded of the positive impacts that this bill will have on Americans, and again, from my state, on Alaskans. It's not a perfect bill. There's pieces that I would like to have improved, and I'm sure everyone in this chamber would. But it's a step in the right direction, a significant step. Just on the financial end, in the first 10 years, it reduces our deficit by $130 billion. In the next 10 years, with the manager's amendment, the improvement and what it did for the deficit reduction is now $1.2 trillion, a significant impact to the national debt. People ask me, they call my office and they say, well, how does it reduce the debt, this type of legislation? And I remind them that between Medicare and Medicaid and VA and Indian Health Services and many other healthcare programs that we deliver, anything we do to improve the system will mean taxpayers save money. And so, again, $130 billion in the first 10 years, and the next 10 years, $1.2 trillion in deficit reduction. The other issue, and again, these are broad sweeps, there's now stronger medical loss ratios. This is important because this starts now, it's 2010, once this bill's passed and a few months after implementation. This is health insurers will be required to spend more of their premiums, which really is your premiums, on clinical services and quality activities, with less going to administration, advertising, profits, excessive pay packages. And if they don't adhere to the new limits, they will have to pay rebates to the policyholders. These stricter limits will continue even after the exchange starts in 2011 and apply to all plans, including grandfathered plans. This is a significant benefit to the individual, the person who has to pay the premium. Accountability for excess rate increases. A health insurer's participation in the exchange will depend on its performance. Insurers that jack up their premiums before the exchange begins will be excluded. A powerful incentive to keep premiums affordable. An immediate ban on pre-existing conditions for children under the age of 18. This, to me, is unbelievable in the sense that this is now added into the manager's packet. A family that struggles, and sometimes the parent or the parents will forego their health care in order to make sure their child is as healthy as possible. But when a child has a pre-existing condition, just to get coverage for them is almost impossible. So this makes sure that no insurance company can ban or deny them access for health care with pre-existing conditions. Ensuring access to needed care. The use of annual limits on benefits will be tightly restricted to ensure access to the needed care immediately and will be prohibited completely by 2014. But starting in 2010, new policies will eliminate the lifetime caps. Also, on the broader scheme, there will be innovation. Medicare will be able to test new models. I can't tell you, every time I had a public hearing or a public meeting in Alaska, or I heard phone calls coming in, what people asked me about was, can't we do something different? How do we improve Medicare? This creates some incentives to move forward on some innovation within our Medicare system. When you look at the small business end of it, the package improvements include starting the health insurance tax credit in 2010. Almost $40 billion of tax credits and tax savings to small business will be available. Transparency. New requirements will ensure that insurers and healthcare providers report on their performance, empowering patients to make the best possible choice. This one, the next issue, multi-state options. This is actually something during my campaign I talked a lot about, the program that we all have here in Congress, and so do almost 4 million federal employees have, and when you include their dependents, almost 8 million. How do we replicate that to give a benefit to the taxpayers of this community, this country, so if they wanted to access something similar? Well, now we have the multi-state option. Health insurance carriers will offer plans under the supervision of the Office of Personnel Management, the people who manage our plan, the same entity that oversees health plans for members of Congress as well as federal employees. At least one plan must be a nonprofit, and the plans will be available nationwide. This will truly promote competition and choice for individuals. Another new idea, which Senator Wyden had been sponsoring for many months and talked a lot about, and that's free choice vouchers, giving more options to individuals with their money. As mentioned earlier, was the community health centers. It is estimated that this bill will now be able to put in place over almost 10,000 community health centers throughout this country, providing, again, easy access and affordable access to folks. The small business end, I want to, again, just broadly sweep on this. The credits will be available on a sliding scale to small businesses. Those small businesses with fewer than 25 employees and average annual wages of less than $50,000. This is truly a small business benefit. But also, if you're a small business with 50 or less employees, you'll be exempt. But if you want to provide insurance to your employees and you're in a small group of 25 employees or under, there will be credits available for you. It also clarifies part-time because we have so many part-time employees that work within the seasonal business in Alaska, retail, fishing, tourism. It clarifies, again, to make sure that small businesses are not hampered by this legislation, but enhanced. Again, 96% of the small businesses will be exempt from this law unless you decide to provide health care, and then you can get some benefits through tax credits, up to $40 billion available. I am a member of a group of freshmen that came in here to Washington this cycle. We came with all kinds of ideas of how we wanted to change Washington in a short order. We sat down, and on this bill, as a group of freshmen, we put together a cost containment package with many ideas in here, very technical in a lot of ways, but just in the broader sense. It creates administration simplification, helps ensure that we go after healthcare fraud enforcement, Medicare system upgrades, making sure that as we develop new systems in Medicare and for the providers, that we can do some pay-for-performance testing, which again will save individuals in Medicare and save the Medicare system over time. The cost containment package, again, that the freshmen put together, we spent many weeks on it, and I want to give credit to Senator Warner for leading the charge with our freshmen, but everyone participated to try to make a difference and bring cost containment to the issue of health care. I want to just go through a quick list again on the broader perspective of this legislation. What happens now? Because you hear always on the other side that so many things are delayed way out, they're not going to happen right away. Well, let me walk through several of the items that happen right away. The Senate bill will make it illegal for insurance companies to drop coverage for Americans who are sick. Basically, they call them rescissions, beginning 6 months after the date of enactment. Insurance companies will also be barred from limiting the total benefits Americans can use over the course of a year, otherwise known as lifetime caps, beginning 6 months after the date of enactment. Affordable insurance coverage options will be made available through high-risk pools for Americans who have been uninsured and have been denied coverage because they have pre-existing conditions, effective 90 days after enactment. Early retirees between 55 and 64. I hear from a lot of them, trying to figure out, as they now are retired, they still have some coverage from their former employer, but it is expensive. Well, what this does is set up a new program, a program that will reduce their premiums, beginning 90 days after enactment. Insurance companies will be required to start posting their overhead costs on a public website, so consumers can better compare the deal they are getting, effective July 1, 2010. Insurance companies will have to start providing internal and external review processes beginning 6 months after the date of enactment. Dependents will be able to receive coverage up to the age of 26 on their parents' policy beginning 6 months after the date enactment. This is one, again, I hear so much when I'm back home and from emails and letters, people wanting to keep their kids on their policy. Again, coverage up to the age of 26. Insurance coverage will be provided to begin covering preventive services, immunization without copays, beginning 6 months after the date of enactment. Seniors will have access to dramatic discounts to the purchases of name brand prescription drugs in the Medicare Part D program beginning July 1. As I said earlier, children under 18, cannot be denied for pre-existing coverage. Free preventive services for seniors, $500 to help offset, or $500 donut hole, the donut hole for seniors, a $500 reduction. Again, the issue with Medicare, I want to say, when we started this effort to reform health care, Medicare was in trouble and could be in serious trouble by 2017. This legislation adds 10 more years to Medicare. Now, to be specific to Alaska, and I'll be brief on this, but I think it's important, many of these issues I just laid out are important to Alaska, but there are quite a few very specific. First, to remind folks what the impact is currently in Alaska. 133,000 Alaskans do not currently have insurance. 27,000 residents who now buy expensive individual premiums would get affordable new coverage. We'll be covering more children, doubling the amount under what we call Denali Kid Care, what we call here in Washington S-CHIP, to more than 15,000 young people, ending the hidden tax on families. About $119 million is spent on uncompensated care, averaging about $1,900 per premium. By creating a larger program that we're doing here, we can eliminate that cost. And I've heard over and over again about Medicare Advantage, and let me tell you how that works for Alaskans. What we'll be doing, we have 60,000 Medicare beneficiaries paying a price for excessive overpayments through higher premiums, even though 99% of our Alaskan seniors do not participate in Medicare Advantage. What you hear when you hear about Medicare Advantage, and those that have it, I'm sure they enjoy it, but in my state, we're subsidizing that. 99% of our seniors do not take that program. So we pay an extra approximately $90 to subsidize that program for those extra things they claim they have. The reality is that we're supposed to be run by the private sector, saving money to Medicare, and it's now costing us more. It's costing my state $90 per Medicare family. About 10,600 Alaskans hit the donut hole in Alaska through the Medicare drug coverage, which can cost some of our seniors up to $4,000 additional per year. We'll see a 50% reduction. As I mentioned on the early retirees, that on the national program, 7,300 Alaskans will be effective in a positive way. 8,600 Alaska small business could be helped by the small business tax credit. Again, Alaska is benefiting a great deal from this legislation. And even more specific, and these are items that I added specifically in the bill to focus on Alaska-specific issues. And I want to thank Senator Harkin on this next one, which is important. It's providing more providers, more primary care providers. It's a loan repayment program, and I know he's been an advocate of getting more primary care providers within the system, nurses, nurse practitioners, physician assistants. The loan repayments go from $35,000 to $50,000 for the National Health Service Corps providing across this country. The program serves health professional shortage areas, including 77 in Alaska. In part because of this and due to other major expansions, the Senate Health, Education, Labor, and Pension Committee is estimating the bill will attract 24,000 new primary care providers. If you want to make a difference to the healthcare system, this is one critical piece. Again, Senator Harkin, I know you have been an advocate for this for many, many years. To see us get to this state and being able to move this forward is significant and will have a positive impact. Another one, which is a program that has had great benefit for our hospitals in Soldotna and Juneau and Sitka. It's the Medicare project supporting hospitals in smaller communities in rural states. Extending that for an additional 5 years moving it from 10 states to 20 states, and creating another 15 hospitals that could participate. The Alaska Health Care Task Force, specifically in this legislation to deal with our Medicare provider issue in Alaska, but also our TRICARE, making sure we deliver the right kind of hospital and medical facility care to our veterans, and more physician assistance. We inserted a specific language to make sure we allow loan repayments for physician assistants in teaching facility faculty to be also included in loan forgiveness. Last year, we had 375 PAs that handled 1.2 million office visits in Alaska. And after 21 years, the Indian Health Service is now in this bill to be reauthorized. 21 years it has not been reauthorized. There are many great things in this piece of legislation from a broader perspective, as I mentioned earlier in my comments, but also very specific to Alaska. Could it be better? Absolutely. But do we think we have a piece of legislation that's going to make an impact to people's lives? Yes, we do. If we want to keep it the same old business as usual, I guarantee you 5 years, 2 years, 10 years from now, we'll be in this hall trying to figure out what to do at a bigger crisis. This is the right decision. It will be an honor for me later this evening to make a vote in the affirmative to move past the cloture vote and getting on to voting for this bill in full. Mr. President, I yield the floor.
Mr. President.
Senator from Iowa.
Mr. President, first I want to thank the Senator from Alaska for all of his hard work on this bill. I think it's fair to say that the Senator from Alaska, a new member of the Senate, I might add, has been very much involved in this bill, and his focus has been on rural health and better health care for Native Alaskans. And as the Senator knows, the Indian Health Care Improvement Act, which also covers Native Alaskans, is included in this bill. And I thank the Senator from Alaska for insisting on that and for being a strong supporter of making sure we do have primary care practitioners, both doctors, but also nurse practitioners, physicians' assistants, other primary health care people who are going to serve in our small towns and rural communities. And the Senator from Alaska has just been one of our best leaders on making sure that we have this in the bill, and I thank him for that very much.
Thank you very much.